So following all of that, the outcomes, all of the supplement review, and then we've had Ilka presented about asparagine supplementation in specific variants. No, not me, Ingrid, did a quick interview with Alice Hadchouel. Is that something in French? I'll learn it. Who is a physician in Paris, who has done work in other R's genes and supplements, and she was at the conference that Terry and I were at a couple of years ago. Ilka reconnected us here in the last couple of months, and so she's interested in actually looking at a formal asparagine supplement trial. So this is Alice couldn't make it here, so we did a quick interview so the rest of you can kind of hear where that is in process in terms of the development of that. Let's see, now.
Hi, Alice. Very nice to see you today. Could you please introduce yourself and your affiliations and where you're at the moment?
Hi, Ingrid. So I am Alice Hadchouel. I am professor in pediatrics, specialized in pediatric pulmonology, and I am the head of the pediatric pulmonology department at Necker Enfants Malades Hospital in Paris. And I've got a big scientific interest for tRNA synthetase deficiencies.
Great. Could you please share with us how you got involved with the tRNA synthetase genes in the first place?
So I got involved in 2015 when I discovered mutation in the MARS-Y gene as responsible for genetic monogenic form of pulmonary alveolar proteinosis in children. And then I started to study the functional impacts of the mutation that I identified. And following this discovery, I progressively pursue my research on this field, and we managed to develop a treatment for this disease, which consists of neural supplementation of methionine.
Can you please share with us quickly what MARS is?
So MARS is a gene which encodes for the methionine tRNA synthetase, and this protein is the protein that ligates the amino acid methionine to its cognate tRNA, and this step is essential for protein translation and protein synthesis in all cells of the body. And if this step is deficient, then it leads to missynthesis of some protein, and also it leads to a stress in the cell. And we believe that this stress in the cell that is responsible for the clinical manifestation of this disease.
Great. And what did you learn from that experience?
So first, I better understand the cause of the clinical manifestation that I see in my patient, that are pulmonary alveolar proteinosis, but also systemic inflammation, a mild neurological involvement, severe liver disease. And so I understood why those patients had several disorders, because those enzymes are expressed in all cells. And I also understand that if you give a lot of methionine to the cell, it will help to correct the phenotype. And I also learned about other tRNA synthetase genes mutation and other deficiencies. And so I am currently wondering if those what I developed for MARS mutations could be developed for other tRNA synthetase mutations or deficiencies.
So yeah, just for people listening, for the reminder, MARS is for methionine tRNA synthetase, and we're focused on asparagine tRNA synthetase and NARS. So when did you first learn about NARS1?
So I learned about NAS1 when I met Rachel in 2023 at the last ARS meeting in Canada. And we discussed about the NAS1 patients, and also we started to have a discussion about therapeutic interventions for those patients.
But how do you think your past experiences with MARS1 translate to NARS1?
Okay, so the fact that the enzymes, the tRNA synthetase are mutated, whatever the tRNA synthetase, they are common features and especially common pathophysiologic features. That is to say that the same mechanism in the cell would lead to the clinical manifestation you will see in a child. What we don't know yet is why some tRNA synthetase mutations or deficiency will give more neurological involvement and no lung involvement, which is the case for the NAS1 mutations, and why others will lead to a more important involvement in the lungs, which is the case for MAS1 mutations. So we don't know yet why there are some difference, but what we know is that for many mutations, whatever the tRNA synthetase gene, there is probably a common mechanism in the cell. And so that's why we are currently wondering if giving more asparagine in NAS1 patients could help them to improve their daily life and to help them in their neurological disorder.
And why do you think it's important for asparagine supplementation to be in a formal study setting?
It's important because when you test the new treatment, it's important to have like a reglementary setting with the health authorities who authorize the trial. Because that's how it goes in medicine. And also because even if giving asparagine could appear like a simple thing to do, because asparagine is like an amino acid, so it's natural. It's not really a chemical synthesized molecule or a complicated medication. Anyway, what I learned from the methionine trial is that if you give, for example, too much methionine, it could be toxic for some organs. So it's important to monitor the plasma levels of the amino acid that you give and to check for any adverse event. In the same time that you check for a potential efficacy, and also to perform the trial in a special setting. It's also help to assess all the patients the same way. And it's important because the trial could be performed in different centers. And so if you perform a proper trial, you're sure that all the centers will perform the same assessment of the patients. And that's the way you will prove or not an efficacy. If every center act the way the physician in the center wants, then you probably won't have a powerful result because everybody will do his way and you don't know. So that's why it's very important.
Thanks. Could you walk us through quickly what the trial would look like for a patient?
Okay, so before the trial, there is a lot of work to do because before getting in the patient, because you have to write the protocol, and so it's really collaborative work because many people will be implied in the protocol, physicians, but also biochemists. And it will be more neurologists that will write the protocol because I'm a pediatric pulmonologist, so I could bring my expertise given my experience with methionine, but I won't be the leader of the project. And then once we write the protocol, we will determine especially how frequently needs the asparagine plasma level to be monitored, what side effects we should look at, and what efficacy we should look at. And so after, for the patient, what we perform for methionine is that every patient was first hospitalized for a stay of a few days to start the treatment. Because once you start, you have to monitor the adverse event and to make several blood samples to dose the amino acid. To check that in the plasma you reach the targeted concentration that you will predetermine using literature search and discussion with experts. And you have also to check that the plasma level will not increase too much and not to have above a threshold that could be toxic. So it will require at the beginning several blood samples. And that's also why, especially in France, we have to respect some rules, because depending on the weight of the patient and the age of the patient, there is a total amount of blood per day that we are not allowed to sample. And so after that, we will also, with the neurologist, use some specific scales to assess the potential efficacy in a child, and probably also perform EKG and EMG to assess if there is a difference in the neurological, both central nervous system and peripheral nervous system progression.
Thanks. Is there anything else you think we should know about the possibilities for patients and collaborations with your colleagues and others?
Yes. So just a few, more words about the protocol. Then it will be a stay of a few days, and then after a regular follow-up. And so one of the big questions for which we don't have the answer yet is that probably for tRNA synthetase deficiencies with an important neurological involvement, some of the disorders will probably start before birth. So that's why for some patients, the supplementation might not be efficient, and we don't know if it will be efficient at all. Because probably some damage is already made to the nervous system before birth. So that's why we still are hopeful for the treatment, but we cannot really know if it will be efficient or not. But I think it's worth trying. And also, what my experience from the methionine trial learned me that for the families and for the patient, it was not like so difficult to be included in the trial. It was not so much that what we propose for the standard of care. So it's not so easy. It's not. I would say that it's not a big burden for the families and the patient if they decide to participate to the trial, if we manage to perform the trial, because to perform the trial, what we need also is money, because you cannot perform a trial for free. And so that's another big issue for the construction of this trial.
Is there anything else you'd like to share with us?
No, I don't think so. I just want to tell the patients and the family that, but I have already mentioned it previously, is that I will not be the leader of the trial, because I'm seeing that really it needs to be a neurologist, a French one or another one, because they are more expert than I am for this specialized for the specific disorders that are NAS1 mutations.
Sounds great. Well, thank you very much.
Thank you. Bye.
Bye.
Any questions at all? I can summarize too, just in case you couldn't understand it all. But basically, Alice is interested in doing the Asparagine trial supplement, but she has a colleague that's a neurologist at the same institution where she works that would take the lead from the clinical aspect of things, because she specializes in lungs. Alice specializes in lungs, and that is actually not something we see a whole lot of in NARS-1, but she has the experience in a similar disorder. And then we also know from HARS patients too, when they've done histidine supplements, how much improvement they've seen. And so really the goal of doing this as a trial is so that as we know about new diagnosis with NARS-1, right? We have a better idea, and also in your children who are older, a better idea of like what the dosing might look like, right? What to expect in terms of small improvements, and just again, like even the adverse events. So there's really tiny bit of information out there. There's only been 3 patients, not with NARS-1, with a similar disorder that have done asparagine supplements, and 1 with minimal effects, 1 with some improvement, and some with a worse effect. Yeah. So I think that's kind of where we're coming from for this, is we want this to be, and Alice mentioned this too, more of standard of care. And so if you don't do it in a structured manner and you can't publish it, then it doesn't become standard of care. And so that's really what we're looking for, for our community, in the same way that's happened for MARS-1, the same way it's happened for HARS individuals. I'm staring at Ilka and Heisi because they've done a lot of work in HARS. So, but I think that's a big part of it too.